Hi, this is Dr. Stella Hines at the University of Maryland Division of Occupational and Environmental Medicine, and I'm going to demonstrate how to disinfect your reusable elastomeric half-face respirator immediately after use with a patient. So this is your coming out of the room and you have your respirator on. This is how you take it off. Set it down on a chucks or paper towel. You're going to do your hand hygiene. And then we're going to wipe the surfaces of the respirator with 4 wipes. The disinfectant can be used, any of the disinfectants that are EPA registered disinfectants with claims against SARS-CoV-2 or human coronavirus, but specifically SARS-CoV-2. And there is a list on the EPA website. Oxyvir TB is acceptable. Dispatch bleach is acceptable. There are other acceptable disinfectants. Okay, so after you have put on your gloves, you're going to take a disinfectant wipe. And first, you're going to disinfect the outer surface of the face mask. So theoretically, this is what was in contact with any sprays. And you're going to wipe everywhere. There are plenty of crevices on elastomeric respirators, but these can be appropriately disinfected. All right, so that's wipe number 1. Wipe number 2 is going to cover the inner surface of the mask. So this is the part that would be in touch with your face. So we're making sure to get any residual facial contaminants like your skin oil, makeup, as well as obviously any microbial pathogens off from the inner surface. Those facial contaminants like oils are more likely to come off just with the abrasion. With this wipe, I want you to gently wipe inside the mask as well. So there are valve covers inside. You're going to gently wipe those with the disinfectant. Theoretically, this never was even exposed to the outside world because it was on your face, but we're wiping everything very completely. All right, so that's wipe number 2. Wipe number 3. So these are the filters for the respirator are encased in these plastic cartridges. So for use in between patients, we're simply wiping down the surfaces of the cartridges. That's the beauty of a covered cartridge, that you can wipe it down. So we're getting both filters, covering the surface, getting in between any crevices. All right, we got one final wipe. The fourth wipe is for the straps and the head harness. And the harness is plastic, so that one's a little bit easier to access. The straps are woven, so you just got to spend a little bit of time making sure that you're covering those surfaces. All right, we've covered all of the surfaces, and I'm going to set this down on a dry chucks so that there's been time for the disinfectant to completely work. We're going to set it down for 2 minutes. These masks are even more clean if you clean them with soap and water by removing the cartridges first and then submerging the mask and the harness, not the cartridges, in warm soapy water and gently scrubbing. And at that part, the harness and the face mask should come apart as well. We're not going to demonstrate that right now. This is the disinfectant use in between immediate need to go see another patient. Thank you very much.